Wound care and wound care education need to be higher on the NHS agenda. With many healthcare professionals spending the majority of their working day treating patients with wounds, they should take a lead in developing clear, practical and relevant wound care guidance. It is incumbent upon wound care clinicians to provide guidance for purchases within the NHS so that they buy in the appropriate equipment and services. In this programme, we speak to Zena Moore, President of the European Wound Management Association. The EWMA works to promote the advancement of education and research into wound management within the healthcare sector. We also hear from leading wound care innovators Pharma, Sorbian AG and Palio Limited, who talk about their innovations and services designed to assist healthcare professionals engaged in caring for patients with dermatological conditions.
The European Wound Management Association, it's an umbrella organisation, and really what it does is that it links together different communities that are interested in wound management. For example, national organisations across Europe that are interested in wound management, and also, for example, local organisations that are linking together, for example, multidisciplinary individuals who are interested in it. And also what the European Wound Management Association does is focus a lot on education and training and developing a really high technology education for wound management across Europe. One of its main objectives through 2009 is really focusing on the fact that we know that wound care costs are very expensive, but in fact through research and development it suggests to us that we can actually make massive improvements in terms of patient outcomes by having more focused attention towards the needs of the patient. So what the European Wound Management Association does is that it works with local organisations in terms of developing the data set in terms of wound management, but also working with international organisations such as the World Union of Wound Healing Societies, the World Health Organization, in really linking together in terms of what are the focus areas that we should be concentrating on in terms of wound management and how can we drive that agenda best forward. And one of the important ways, as I said, is to develop a database, but also it's to consider how can we actually implement the knowledge that we have already. And one of the important focus areas for us is the patient outcome group, which is really looking at, well, what are the key drivers that are important in terms of wound management? What are the outcomes that we're interested in terms of really will make a difference to patient groups? And how can we implement what we already know into practice? And some of the projects that we've been involved in are, for example, the Leg Ulcer project, which is in Slovenia, in the Czech Republic and in Poland, which is taking what we already know, assessing what the baseline is in those countries, and also then developing strategies whereby we can improve the baseline and we can also measure outcomes.
Pharma is an independent Belgian company that was founded in 2000. It specializes in the development of advanced and innovative wound care treatments that address unmet clinical needs in this field. I personally became involved in wound care following a tragic accident in which the 14-month-old daughter of a family friend got burned with cooking fat. Her burns were treated with flamazine, but unfortunately she was allergic to the treatment, and at this time there were little alternative treatments. And as an industrial pharmacist, I knew it should be possible to find a new treatment. I worked closely together with the Burn Center at Antwerp, and with their knowledge of the requirements of burn care and my pharmaceutical knowledge, we could develop a new burns product. And this is how Flamigel was created.
All of our products have been developed to address unmet clinical needs. They all feature our patented polymer technology, and our antimicrobial range of products also have a unique enzyme complex which allows them to selectively destroy bacterial cells without harming any skin cells in the process. Flamigel, or Savlon Advanced Healing Gel, as it is better known, is a hydroactive colloid gel. It creates optimum healing conditions by creating a moist wound healing environment. Flamigel is indicated for superficial burns and minor wounds, such as cuts and grazes. It combines the activity of a hydrocolloid with that of a hydrogel. That is, one absorbs and one hydrates, according to the state of the wound. Flaminol Forte and Flaminol Hydro are very exciting as they belong in a new class of wound care products called enzyme alginogels. Gels. The key characteristics of Flaminol are that they keep the wound moist, they carry out continuous debridement of the wound, and they restore the bacterial balance. Compared to some popular antimicrobial wound care products, Flamanol is non-cytotoxic. That is to say, they do not destroy the host skin cells essential to wound healing. Their formulation contains no allergenic substances, and so they are suitable even for allergic patients. To restore bacterial balance, the novel patented enzyme system kills bacteria. As the enzyme system kills only the bacteria absorbed inside its alginogel structure, it does not affect dermal or epidermal cells responsible for wound healing. So skin cells continue to multiply quickly to heal the wound. Bacteria coming into contact with the enzyme alginogel activate a sequence of enzymatic reactions that result in the production of free radicals, which selectively kill a broad range of bacteria without damaging or affecting the dermal and epidermal cells that are responsible for wound healing. Moreover, no bacterial resistance has been reported to date. As we all know, chronic wounds differ enormously from acute wounds. There are a few key objectives in the management of chronic wounds, and these are described in the time framework by the European Wound Management Association. In this, the T stands for tissue management and debridement, I for infection and inflammation control, M for moisture control, and E for the advancement of the epithelial edge. And so the features of a good wound care product and wound care in general are debridement, in which the wound is kept clean, that the bacterial balance is maintained, that the product is devoid of skin cell toxicity, that the product maintains a moist milieu and protects the wound borders from maceration. And this is exactly what Flamanol does. And to date, it is the only product that has all of these properties.
It's fair to say that we believe that Pharma offers a new class in wound care, that of an antimicrobial activity which does not impair skin cell growth and embedded in a time-based wound healing concept. Bringing progress to wound healing is a multidisciplinary and scientific endeavor. But much more so, I feel that this is an endeavor that requires partnerships between wound care providers, such as in hospitals and in home care, and us working in labs. Creating such an environment is not easy. It requires perception, deep understanding of the problems to be solved, and not in the least, openness of spirit and willingness to work together. The one depends on the other. Whatever we have achieved at Pharma is precisely due to the help and support that we received from all those that offer wound care in daily life. And let me end by quoting a great 19th century French scientist, Louis Pasteur, who wrote, "Chance favors only the prepared mind." My personal wish is to keep such mind in order to contribute to progress in wound care.
One of the biggest challenges for practitioners today is that there's an ever-expanding array of products and innovations that are available in terms of managing both acute and chronic wounds. And the decision-making process for individuals is challenging because there's a number of different factors that they need to think about. And I guess Muir Gray told us about evidence-based practice, and the fundamentals of that are looking at clinical expertise, they're looking at patients' expectations, and they're looking at the evidence. So in terms of clinical expertise, we'll be able to identify. See, because evidence comes from many different places, and evidence can come from, in fact, we can look at laboratory studies, and these will tell us how the products actually work. We can look at clinical case studies which tell us how the products actually work with individual patients. And then, of course, we go to the higher level of evidence where we're looking at randomised controlled trials that have studied these products in large numbers of patients, and move on up to meta-analysis where these randomised controlled trials, when they're looking at similar things, are joined together to say what the body of evidence is. But oftentimes we then come back to the clinical setting and we find that our clinical expertise is really important, because that's what fundamentally says to us, well, how relevant is this clinical evidence to me within my own clinical practice? And another really important focus for the individual is to think about the patient, because at the end of the day, the patient's preferences are really important, and what the patient thinks and feels about the treatments that we're offering will fundamentally initiate whether or not those treatments will work. So I guess what I'm saying is that the practitioner uses a threefold process in terms of looking at how best to implement good practice within their own clinical setting.
Sorbion was established because we believe there is an urgent need for an innovative way of how to manage wound fluids. If we are talking about the best way to heal a chronic wound, we need to cover several clinical challenges. This includes drawing out excessive amount of exudate, retain the fluid, and also providing anti-inflammatory properties and debriding capabilities. This has to result in promoting wound healing at reduced costs. And hydration response technology has been created to meet such challenges. We use specific gelling agents based on high-performance polymers, which are embedded in specific treated cellulose fibers. The gelling agents actively manage the hydration level of the cellulose fibers when they first come into contact with exudate and quickly reach an optimal moisture balance. By keeping the cellulose fibers at the correct level of hydration, a hydration balance is maintained between the wound surface and where it is in contact with the dressing.
Healthcare systems around the world are all suffering from the same types of cost pressure, and the NHS is no exception. So it's essential that when we launched the Sorbion range, we developed a range that was genuinely cost effective. And we believe we do that in a variety of ways. First of all, if we take the unit price of the dressing, that is actually cheaper in many instances than some of the leading brands of foam dressings, of hydrofiber dressings, of alginates, and of hydrocolloids.
I work as a tissue viability nurse within an NHS trust. As such, part of my responsibility is that I need to examine both the clinical and the cost effectiveness of any wound dressings that would go onto the formulary within the trust. This is obviously important because we need to have the clinical effectiveness as far as the patient is concerned, and of course the clinician, but also we have a budgetary responsibility and an organisational responsibility to our trusts to be cost effective as well. So as far as the Sorbion products are concerned, what we've examined and evaluated and found through using these with our patients is that we've been able to find benefits on several different levels. Firstly, as far as the patient has been concerned, we've had a reduction in the amount of dressing changes that a patient has to undergo. This is clearly beneficial to the patient, since for a number of them there may be some pain or discomfort involved in a dressing change despite good analgesia. So consequently, if you can minimise the number of dressing changes, that's always advantageous to the patient.
Absolutely, fewer dressings are necessary in clinical use, but more critically, we are actually able to save nurse time. So in a hospital, that means that a nurse has more time to get on with her other duties. And in a community setting where we estimate that the cost of each nurse visit is somewhere between 60 or maybe even £80, the reduction in the number of visits can generate very significant economic benefits. But more than that, Sorbion can actually replace some of the other dressings that you use. So for example, in many instances you will not need to use an antimicrobial dressing when you use Sorbion, because of course the product will draw out the bacteria along with the exudate.
Many of these patients have skin sensitivities and often known allergies as well. We have found on using the Sorbion products on patients with known allergies and skin sensitivities that it has provoked no reaction at all from their skin and is truly can be called a hypoallergenic dressing, which is clearly yet another advantage. This is a product that is advantageous on so many levels that I think it would be a real omission if it were left out from a formulary, because of the true cost effectiveness in these days when the NHS, like any other health provision, is struggling, and also, of course, from the quality aspects of exudate control, providing a hypoallergenic dressing, reduction of dressing changes, etc. I would recommend Sorbion Sana to my peers and also to patients and relatives that this is a product that is advantageous on so many levels that I think it would be a real omission if it were left out from a formulary, because of the true cost effectiveness in these days when the NHS, like any other health provision, is struggling, and also, of course, from the quality aspects of exudate control, providing a hypoallergenic dressing, reduction of dressing changes, etc.
On the face of it, Sorbion is a very simple dressing, but yet is the result of many years of research and development. From a technical perspective, we call the concept hydration response technology, and this is all about managing the environment between the wound bed and the dressing itself, creating a hydro balance that enables a dressing to meet the challenges of excessive exudate, of bacterial load, and of desloughing the wound. And from a cost perspective, we have created a dressing which has, in our view, a competitive unit price, but above all is able to reduce the number of dressing changes, to save nurse time, and which means that wounds also heal more quickly, which delivers immediate bottom line benefits and of course makes for happier patients too.
Planning and implementing interventions for nursing, for the nursing care of individuals with a lot of complex wounds, there really are a lot of things that the individual has to think about. And I suppose if somebody is in the planning and development of services, well, the first and foremost thing we have to keep in mind is the fact that the demographics are changing. And by the year 2050, 25% of the population is going to be over the age of 65. And unless we have good preventative strategies in terms of, for example, pressure ulcers, then it's likely that these problems are going to increase into the future. But hand in hand with that is the fact that we are also bound by a limited resources. So therefore we're asked, for example in Ireland, the value for money audit will ask us, for every euro we spend, are we sure we spend that money wisely? And therefore the treatments and the interventions that we offer, we have to be sure that those interventions work, that they're cost effective and that they're targeted at the right places. So understanding the epidemiology of wounds enables us to be able to target our resources wisely. And the other thing we need to think about as nurses is we have to bear in mind our own competency, and competency isn't a static thing, it's something that develops over time and changes. So unless I keep an eye on my own competency, I keep an eye on changing demographics and epidemiology, then I'm not going to be able to plan in terms of the future. And the other thing we think about, which is the evidence base. And so being mindful of the evidence is one thing, but being able to critique and apply that evidence into clinical practice is really challenging. So there are a lot of skills that somebody needs to do, but the beauty is that through organisations like the European Wound Management Association, a lot of that information is assimilated together, so that, for example, we have really good education packages that look at different aspects of wound management that incorporate all of the issues that I've discussed, which actually is a user-friendly guide to those who want to develop education in this area in their practice settings.
Palio Limited is an Israeli biotechnology company. We've been in existence for 10 years, and the core of the company is a technology based on polystyrene microspheres. And the first of many therapeutic uses which we've investigated is the field of wounds, specifically chronic wounds. Our lead candidate product, PolyHeal 1, has two major components. It has polystyrene, charged polystyrene microspheres, and they are embedded in a nutritional medium and packaged in 15 ml bottles to be applied topically to chronic wounds. The product has gone through an extensive preclinical and clinical testing and has been recently licensed by the European Union as a Class 2B medical device. What's most important is the contact between the polystyrene microspheres and the wound bed. When they are topically spread over the wound, they come into direct contact with the number of cells inside the wound bed. And there are two major things that happen. One is PolyHeal is an activating technology. It's not something that we passively administer to the wound, but rather it's something that comes in contact with the cells and mobilizes and gets them on track to the normal healing process. The second important point with PolyHeal is it's not targeting one singular cell or mechanism for wound healing, but in fact it affects a number of different important phases and cell types involved in wound healing. And so we know that when the cells first come in contact with PolyHeal, there's an inflammatory response that engages the macrophages and eventually cytokine activity and growth factor activity. We also know that the cells themselves, the beads, the microspheres, adhere to the cells and allow them to move into the wound bed eventually. And this is important for endothelial cells, epithelial cells, and keratinocytes in terms of eventually the process we call epithelialization. And so finally, it's very important to have both this activation effect as well as the multi-process and multicellular effect to have what we see as a more dramatic clinical response, because we're mobilizing almost the full resources of the body.
Initially, we were certainly thinking about the results we have been presented, but when we then applied the device, we were very positively surprised by it. We had treated our toughest patients with the device, who actually underwent all kinds of treatments before, including dressings, vac treatment, transplantations, whatsoever. The mean duration of the wounds we treated was roughly 5 to 6 years, some were up to 18 years in duration. Initially, we realized a very rapid improvement of the wound. They showed marked granulation, up to 100% in some cases, in instances where we didn't see any progress for weeks and months before. So we decided to continue, specifically for these hard-to-heal wounds. We consented, together with 4 other major wound healing centers in Germany, to start a small pilot trial. We contributed 7 patients. These were patients who have been treated in our center for partly more than 7 years, and we applied PolyHeal according to the Israel prescription twice daily initially, and were very surprised to experience a marked improvement of these wounds already in the first few weeks of treatment. Already after 2 weeks we could see considerable increase of granulation, and at the end of the treatment phase we saw a marked reduction of wounds, wound closure or complete granulation in wounds that had been totally inert up to that time point.
Seitdem wir mit PolyHeal arbeiten, sieht man eine sehr gute Verbesserung der Wunden, chronischen Wunden, und es ist vor allem besser, dass die Zeit der Wundverschlüsse sehr kurz sind. Und die Patienten haben es sehr leicht mit der Lösung, mit der Wunde umzugehen, die Verbände selber zu machen und vor allem in so einer kurzen Zeit natürlich die Wunde, dass das geschlossen ist. Und der Patient ist glücklich, wir sind natürlich noch glücklicher. Ja.
I certainly am convinced that PolyHeal will be an important product in the future. Specifically for hard-to-heal wounds is a very important integral part of the wound healing process in all kinds of wounds. As a scientist, we are not trained to be enthusiastic, but the first results we have seen about the clinical effects of PolyHeal have been extremely impressive. And given that the clinical trials which are going on at the moment come to the same conclusions, I would consider PolyHeal, the introduction of PolyHeal, as one of the most innovative and exciting new components which we have observed in the wound healing scene for the last 10 to 15 years.
PolyHeal is a new and innovative technology in a field where there's still a fair amount of unmet need, particularly in the very hard to treat cases of various etiologies, particularly the deeper, more complex wounds with exposed bones and tendons, and the more complex wounds of various etiologies. PolyHeal comes along with a promising clinical history and appears to fill that void that currently exists. It also is very easy to use, very safe, because the ingredients are chemically inert. And so we have the potential here to take on the one hand this efficacy in the very hardest to treat cases and combine it with something that is safe and easy to administer as well. And bring it to the marketplace. And of course, we will continually add clinical data to demonstrate the efficacy. We will try to continually improve the application of the product, to extend the application frequency, and of course are always listening to our customers and to hear how we need to evolve as a product and as a company in the future.
We hope this has been a valuable resource for healthcare professionals engaged in treating patients with dermatological conditions. I'm Georgina Burnett, and you've been watching Advanced Wound Care within the NHS.